Hi there, welcome back. You're watching Times Now with me, Meghna Dekar. Well, have you been coughing or sneezing right now? Well, then you may want to get it checked. Well, a sharp rise has been recorded in H3N2 influenza cases in India. Well, this virus leads to respiratory symptoms, including persistent cough and many others. Well, India has recorded 2 deaths so far, 1 each in Karnataka and Haryana due to influenza, a subtype H3N2 virus. A quick change in weather has been identified as one of the major reasons for it. In fact, the Union Health Ministry has now sounded an alert and put the states on high alert as well. The states have been asked to keep a close watch on the rising cases in India. In fact, the Indian Council of Medical Research has also issued an advisory asking people to maintain proper hygiene and sanitize while avoiding contact with infected people.
இந்தியா முழுவதிலும் H3N2 என்று சொல்லக்கூடிய ஒரு வைரஸ் காய்ச்சல் இந்தியா முழுமைக்கும் பரவிக் கொண்டிருக்கிறது. இது சம்பந்தமாக கடந்த வாரம் ICMR ஒரு அறிவுறுத்தல் ஒன்றினை வெளியிட்டிருந்தது. இந்தியா முழுமைக்கும் பரவிக் கொண்டிருக்கிற இந்த காய்ச்சலிலிருந்து மக்களை காப்பதற்கு உண்டான நடவடிக்கைகளை சுகாதாரத்துறை மேற்கொள்ள வேண்டும் என்கின்ற வகையில் மாண்புமிகு தமிழ்நாட்டின் முதலமைச்சர் அவருடைய வழிகாட்டுதலின்படி இன்றைக்கு 1000 இடங்களில் சிறப்பு காய்ச்சல் முகாம்கள் நடத்த தொடங்கி இருக்கிறோம்.
मरीजों की जांच की जा रही है। जांच के बाद उनको उच्च कोटि की चिकित्सा व्यवस्था उपलब्ध कराई जा रही है। कोई पैनिक जैसी स्थिति नहीं है। पूरे लखनऊ में हॉस्पिटल्स की कल की संख्या है कि GMC में 30-35 हैं, बलरामपुर में 20-25 हैं, सिविल और लोक बंधु में 15-15 मरीज हैं। कोई पैनिक जैसी स्थिति नहीं है।
क्या वजह डॉक्टर से पता चल पाई?
ये मौसम चेंज के कारण ऐसा होता है और धीरे धीरे स्थिति 2 दिन में कंट्रोल में आ जाएगी।
Well, let me go across to our panelists here on our show. Joining us, 2 doctors. Dr. Ankita Baidia is joining us, a consultant of infectious disease, HCMCT of Manipal Hospitals in Dwarka. There's also Dr. Anil Vardhani, who's joining us, the Director of Internal Medicines at BLK Max Hospital. Well, I'm going to first go across to Dr. Baidia because many people, the first thing everyone's discussing and talking about it, the first thing that everyone's asking, how do we know if we have this variant of influenza, because the symptoms are very confusing, very COVID-like symptoms?
See, first of all, to know exactly which variant we are dealing with, we have to go with the genetic test of that virus through the throat swab. But if we see the symptoms of COVID-19 and the influenza being a viral disease, we see almost similar symptoms, but we don't see the loss of taste and smell in influenza. We see a lot of GI symptoms in influenza. We see a lot of upper respiratory tract symptoms in influenza, like congestion, nasal congestion is there, sore throat is there. But the incubation period, if I talked about, like if somebody gets infected and somebody manifesting the disease, is usually shorter when it comes to influenza. So if somebody is having, if people are having like in the family, 3 to 4 people in the family, and all of them are showing some sort of viral illness, and if we see the chain of event that has happened around the incubation period being short in influenza, it's around 1 to 2 days, we see the gap in the symptoms that all the family members are getting infected, some sort of symptoms. It might happen that everybody in the family is not showing the same symptom, but yes, some sort of like malaise could be there, or URI symptoms, or GI upset, and knowing that it's a viral infection, it is going to affect your like more than one system. Like you will have a URI symptom and the GI disturbance. Don't take antibiotic, consult a doctor. Don't do self-medication in that, because in cases of viral, the antibiotics are not going to help. We have a dedicated antiviral for influenza. We have that, oseltamivir is there. But until we know that this virus is there, or you belong to a high-risk group, then only it is recommended to have this antiviral after a doctor prescription and getting tested for H3N2.
And that's very important what you said. Don't try to don't try to cure yourself with self-medication. Do go to a doctor. It's important you don't self-medicate. There has been a lot of confusion, a lot of myths roaming around this specific influenza, which is why we've opened our call lines. You, the viewers, can speak directly to these doctors. If you have questions, do feel free to call in. We have flashed those numbers at the bottom of your screens. Before I come to you, Dr. Anil Vardhani, let me go across to one of our viewers. We have Fernandez, our viewer, calling us from Mumbai. Go ahead, Fernandez.
Yeah, I want to know why does the test cost 3,000 rupees for this H3N2 along with H1N1?
Okay. Dr. Vardhani, does the test cost 3,000 rupees? That's going to be a huge deterrent. If people have to shell out that kind of money, that will make detection and tracking harder.
Because it requires the biological RT-PCR, which is a costly affair, but I want to tell our viewer, it is not required for general population. Only if patient high risk group, then test is required for confirmation. Otherwise, symptomatic treatment is only suffice.
That's a very important point. Everyone doesn't need to go and get themselves tested. Only those patients which are at high risk should go in for this test. Everyone can be otherwise be treated as per the symptoms that they are showing. Another one of our viewers, Praveen, calling us from Mumbai. Go ahead, Praveen.
Yeah, hi. About this, I'm a diabetic as well as have high blood pressure. So just wanted to confirm what are the risk factors basically, and this is infectious?
Dr. Bedya, could you answer that? Diabetic as well as high BP?
Yeah, so this is actually a risk factor to develop a severe influenza because it's an influenza A. The good thing, we have a vaccine available for this.
Okay.
And it is recommended for this group who has comorbidity, like people who are diabetics, even if they are a younger group, like we are seeing diabetes these days in above 30 also, in the younger population also they are coming with diabetes, hypertension in the COVID era. So if they're having this, they can definitely go for vaccination, which is a preventive step for them. And yes, they belong to high risk. If the symptoms of influenza is there, and if it's actually significant symptoms, if your doctor feels that you require this test, then it is done. Not always, as Dr. Vardhani has rightly said.
Right. So that's also another very important point that our viewer had raised. What happens when you have other ailments as well? Go in for a vaccination is what the doctor advises. Another one of our viewers, Anurag, calling us from Delhi. Anurag, go ahead. Do you have a question?
Yeah, doctor, good evening. See, I want to ask, my mother is about 79 years of age and she has a CRTD device which has been implanted. Now, she doesn't have any kind of sputum, but there is a lot of coughing which is happening.
Okay. Well, I'd request all our viewers to please put your television sets on mute. Otherwise, there's going to be a bit of delay and there will be echoes coming in. But Dr. Vardhani, if I got our last viewer right, Anurag was saying that his mother, who's 70 years of age, that she has a lot of coughing. Should he get her tested?
Yeah, she comes under the high-risk patient because it is having the device. She is a cardiac patient and elderly patient. So for the interest of the viewer, all diabetic, hypertensive patient, cardiac patient, those are having the heart failure or and other chronic illness and pregnant ladies. All these are group comes under the high-risk group. So at the time of these outbreaks, these patients are required to be tested.
Well, thank you so much for explaining to us who are the high-risk patients. More of our viewers are calling in. We are going to try and incorporate as many questions as we can. Our viewer, Shripati, calling us from Hyderabad. Go ahead, Shripati.
Hello, doctor. My question would be, when we had this COVID, breakthrough and the vaccinations, vaccination that were available. So that was meant to give the immunity. Now, with the influenza that we're seeing with the similar symptoms, so why is the same immunity not being seen?
Are you talking about the COVID vaccine?
Yeah.
Yes, Dr. Vaidya, if you could answer that, COVID vaccines have been taken. Does that show immunity against H3N2 as well?
Yeah, so actually it's a different virus altogether. It's not the coronavirus, it's a different virus. It's an influenza virus. Okay? So they will not have any cross-protective immunity, but we have a dedicated vaccine for flu virus. And that is like that we are using this since long. It's not a new vaccine. Very much effective, recommended in pregnant ladies also, that much safe. So you can take influenza vaccine, which is going to prevent this severe influenza infection by influenza A major strain and 2 of the influenza B strains also. So
can you give the name of the vaccine again?
These viruses keep on changing their structure. So this is why they keep on mutating. So this is why every year WHO announces the particular strains of virus, influenza virus, that is needed to be in the vaccine so that it is preventing for that flu season. So it is mutating so fast. So the herd immunity questions is actually very far when we talk about influenza.
They're completely different. But Dr. Vaidya, can you, for the benefit of our viewers, give us the name of the vaccine as well?
So we have like a quadrivalent vaccine that is available from different companies. I will not talk about the trade name of that, but we have quadrivalent vaccine available, and it is given intramuscular single shot every year.
Okay.
And every year, if I talk about for the Indian strain, it is available in the month of August, and you should always vaccinate yourself if you belong to a high-risk category. Dr. Vardhani has already mentioned the high-risk group who should always take. Apart from that, healthcare workers, people who are frontline workers who are overly exposed in the community setting, they should also take.
Absolutely. That's very important for all our viewers to note. Another one of our viewers, Sanjay, calling us from Hyderabad. Go ahead, Sanjay.
Yeah, hi, good evening. I'm Sanjay from Hyderabad. How do we differentiate between this influenza virus and a viral fever which has a cough? For example, a known person has been having coughs for last 1 week with fever. Doctor has prescribed medication. It's come down, but it's not gone completely.
Dr. Vardhani, can you take that?
Yeah. So whenever there is syncytial influenza, other type of the influenza or upper respiratory tract infections are prevalent in the community, it is very difficult to differentiate among 2 type of the as only on the clinical basis. So that's why only in the high risk group. Otherwise, whenever there is a viral outbreak, we have to treat the patient symptomatically, so nothing to worry. Only and as in the COVID, the patient can go for a just to observe some red flag signs, means if patient having breathlessness or during the COVID time, a lot of the accessibility of the oxygen pulse oximeters, so they can check their oxygen levels. If there is more than 95, nothing to worry. This just require a symptomatic treatment. If it is less than 95, please must consult to the specialist, means a doctor. Or if it is a less than 92 and 90, then the patient may require hospitalization. This is usually happens. Unfortunately, the 2 deaths happens, and they all, one is from Haryana, is suffering from cancer, and another from Karnataka, is a diabetic and hypertensive, and both are elderly patients. Yeah.
So there was comorbidity involved as well, and these were high-risk patients, which is why it's important for us not to panic looking at the statistics. Our viewer, Landrain, is also calling us from Delhi. Go ahead.
Good evening, doctors. My name is Landrin and I'm from Delhi. I'm just a little worried and I need to check this question with you. When we are sitting in office, we are sitting very close by. And, people are all this cough, cold, some having fever, some having throat ache. So do we have to worry about wearing masks and, maintaining social distancing?
Dr. Vaidya, should we mask up?
So, see, this H3N2 is not a new strain as such, but yes, the basic precaution lies the same way as we were dealing with COVID. The thing is, it is very infectious in the prodromal phase also, and the incubation period is short. So when you start having the first symptom, if like somebody in the family is having the first symptom, maybe just a scratchy throat is there, and since we know this virus is in circulation, you have an elderly parent at home or a small child or like a comorbid person at home, then it is spreading the same way through, and wearing a mask will definitely help. Also, hand hygiene will definitely help. It will prevent other members of the family, but yes, right timing is also very important. Once everybody is infected, your mask is not going to prevent the spread in the family. But yes, if you're stepping out for some work, it is going to prevent the spread in the society. So yes, you can gear up with the mask and practicing hand hygiene. If somebody is having signs of infection, it prevents the spread.
This is very good advice that the good doctors are giving to us. Thank you so much. Unfortunately, we are running out of time. There are a whole host of other viewers also who have been calling in. They too want to speak to you. Unfortunately, we are running short of time. But thank you so much, doctors. And that is the big message that both the doctors have given, that you must prepare, but don't panic. Well, with that, a short break.